Hey guys, welcome back. I'm Dr. Dustin Portela, board certified dermatologist, and last time I talked about all of the most effective over-the-counter treatments for acne, and today we're going to be talking about what should you do if the over-the-counter treatments aren't working and aren't clearing up your acne as effectively as you'd like. So like I said, treating acne can be very frustrating and there's a lot of over-the-counter options. However, if those don't work for you, it might be time to go and see a dermatologist. Now, I know that seeing a dermatologist in person can be an expensive thing, and sometimes you don't feel like you get the most time out of your doctor. And so I want to give you a few tips and tricks to make sure that the visit is the most effective that it can possibly be for you so that you get your money's worth and that you get a regimen that's most likely going to work for you. We're going to cover a few things that you should ask your dermatologist and a few things that you should make sure to tell them before you leave with prescriptions and instructions in hand. First off, when you call to make an appointment with a dermatologist, you may be seeing a dermatologist or the office may be recommending that you see a physician assistant or a nurse practitioner within the practice. My recommendation is that you be at a practice with a board-certified dermatologist, and if you're able to schedule with the dermatologist, of course, that's my recommendation. But if you're scheduled with a PA or an NP, they also can do a great job of educating you and helping to prescribe treatments that are going to be good for your acne. I just recommend that you're in a practice that has good supervision with a board-certified dermatologist so that if you're not getting better, you always have the option to see the dermatologist. So really that becomes the first tip, is to know who you're scheduled with and what their credentials are. So now in preparation for your appointment, you should make sure to gather all of the materials that you've been using over the counter. Make sure you take the wash and any spot treatments that you've been using that we talked about in the last video. Once you've gathered the things that you're using, you don't have to bring everything you've used over the last couple of years. I would just focus on the things that you use most consistently, whether they worked or not. But pick a wash that you like, pick, a spot treatment or a retinol, whatever you've been using, put it in a bag and bring it with you. That's going to do a couple things. When you're visiting, you can show the products that you've used. You can talk about if they were beneficial for you, if they worked for your skin type, or if they caused a lot of irritation, because that kind of information will help your provider to get you on the right prescription regimens to help clear up the acne. The next thing is that on the day of your appointment, I recommend not wearing any makeup. You can wash your face, you can use a moisturizer, but don't put on anything with a tint like a tinted sunscreen or any makeup, because the provider really needs to see your skin. We need to be able to see if you have scarring. We need to be able to see if you have pigmentation, like post-inflammatory hyperpigmentation. And that is going to tell us about how your skin responds to irritation and inflammation, and is going to help to lead to more accurate diagnosis and more effective treatment. So no makeup on the day of your acne appointment. When you're with your provider, one thing you want to ask, if you don't already know, is what is your skin type? Your skin type is going to dictate what kind of topical treatments will work for you, because if you have very dry or sensitive skin, it's important not to prescribe a really strong retinoid product, for example. Those are a lot more likely to cause irritation, and if you're not going to be able to use them because they cause irritation, they're not going to work for your acne. So ask what your skin type is, and they can help to determine if you're more dry, more normal, combination, or oily skin type, because that will play a role in the types of topical medications that you can tolerate using. Now, if your provider doesn't ask where your acne is located, you need to make sure to tell them. Acne most commonly occurs on the face, of course, and some people get it predominantly on the chin and jawline, some on the forehead, some all over. But you need to make sure they know. If you have acne on the chest, back, shoulders, or your backside, it's important to tell them that, because topical treatments are less effective on the back and you may need oral medication. So make sure that your provider understands what is the distribution of your acne, where is it located, and that way they can tailor the treatment to where your acne occurs to get you clear, not only on the face, but everywhere else on the body. Another important step is if you have regular menstrual cycles, it's important to tell your provider if your acne flares around that time of the month. If you have hormonal acne, the treatment can be a little bit different. You may use oral medications like spironolactone, which can help to control hormonal acne, or you may be a good candidate for birth control. Those are decisions you have to make with your healthcare provider, and that's not something that I can really tell you, but I can tell you that it's important for a provider to know if you have regular flares of your acne that may be associated with hormones, because again, that can tailor the treatment. And if you don't tell them and they don't ask that question, you don't let them know in some way, you might miss that step and then your acne isn't going to improve like you want it to. Now, this is a question that I ask all of my patients, but if you're not asked, again, you can tell your provider. How motivated are you to make your acne better? Hopefully you're fairly motivated because you're at the dermatologist, but some of the patients that I see are there with their mom or their dad, and they didn't particularly want to be there because their acne isn't that bothersome to them. So it's important to clarify how much your acne bothers you and how motivated you are to make it better. The reason that it's important to know that is because if I design a regimen for somebody that requires a step in the morning, a step in the evening, and requires a pill to take, but they have little motivation or interest in making the acne better, they're really not going to use the products as intended, and they're not going to get better. In that case, I would prefer to do once a day cream, make it very simple, and try to pick the one that will be the most effective for that individual. So it's important to let them know how motivated you are to get better. If you're very good in following a skincare routine and you can wash in the morning, use a treatment, moisturize, sunscreen, and in the evening, again, you can wash, dry, put on a retinol, for example, moisturize and go to bed. If that's easy for you to follow, then you'll do better by having a more comprehensive regimen. But if you're barely remembering to brush your teeth, it might be best to just pick one cream and use it really consistently. Along with choosing creams and medicines, you need to know if you're going to be doing it once a day, twice a day, different thing in the morning, different at night, and if you're going to be taking a pill. Now, your provider might recommend a pill if you have a lot of inflammation. And the pills that we commonly use are oral antibiotics, and we tend to use them at low doses. It was not uncommon in the past for dermatologists to put people on antibiotics for many, many months, sometimes even years. And thankfully, we've gotten away from that practice and tend to keep antibiotics at low doses for short periods of time. Antibiotics are particularly good at decreasing inflammation in the skin, but they can cause some side effects, so it's important to clarify that with your provider. Some of the antibiotics that we choose may increase your risk of sun sensitivity, so you have to be careful if you're out and about so you don't get a sunburn. Sometimes they can cause an upset stomach or headaches, and so you need to be aware of should you eat food if you're taking an antibiotic, or if you need to exercise additional sun protective measures. So those are important questions to ask if you're going to be taking an oral antibiotic. Sometimes you may be put on birth control, and that can be very effective in regulating acne for some individuals, but it comes with different risks that you'll have to discuss with your healthcare provider. But birth control is not necessarily something to be afraid of. Many of them are actually approved by the FDA for the treatment of acne. In some circumstances, your provider may recommend Accutane even at the first visit. That means you probably have severe cystic acne and aggressive treatment is warranted. We're going to cover Accutane on a completely different video, so I just wanted to plug it in here for a minute and let you know we will be discussing that in a future video, so be sure to check back for that. Next question that's important to cover when you go to be seen by a dermatologist for acne is, should you start all of your medications day one and use them every day? Sometimes I encourage my patients to start by using the creams every other day or every third day because most of the things that we prescribe for acne do have a small risk of causing irritation and dryness. And again, like we've talked about, if you get really dry and irritated, you're not going to use them and they're not going to work for you. So clarify if you should kind of ease into it by doing a kind of graduated introduction by going every third day. And I do recommend using a moisturizer frequently if you're started on lots of medicines that can cause dryness of the skin. Now, if you're seeing a dermatologist for acne, likely it's been there for quite a while and you've tried a lot of things over the counter. It's not going to go away overnight, unfortunately. So always ask when you should expect to see results. Most acne treatments are going to require at least 4 to 6 weeks in order to start to show improvement. That's at least how long it takes for your skin to turn over and start to see new, healthy skin come up. In some rare circumstances, you may get worse before you get better. Some people on social media call this the purge, but it's not something that we think commonly about in dermatology. When we hear about the purge, oftentimes it's just dryness and irritation from a retinoid. It's not a really bad flare of acne before you get better. So clarify when you should expect to see results from the medicines. Some of them can be as early as 4 weeks. Some of them may take much longer, especially pills like spironolactone or birth control. They may take 2 or 3 months before you really start to see results. So patience is important, and along with patience is consistency. Be consistent with your treatment and you're more likely to get the benefits. You've gotten through everything. Now you need to ask, when are you going to come back? That's something the offices are usually going to set you up for before you walk out the door that day. So make sure you know when it's appropriate to come back. Are you scheduled to come back in a month, 2 months, 3 months? What is their plan to make sure you're getting better, or when they need to change the treatment so that you can get the results that you're looking for? If they recommend that you come back in 2 or 3 months, you need to ask, should you come back earlier if there's a problem? And maybe clarify what those problems are. If you get significantly worse with the treatment regimen, you might need to sneak back in there a little bit earlier. So ask them when you should call if there's a problem. And the last thing that I like to cover, at least briefly with many of my patients, is what are we going to do if this plan doesn't work? Unfortunately, acne treatment isn't an exact science in every single person. We need to kind of determine how you're going to respond to treatment. If we pick something that's too drying, didn't work for you, or your acne changes and gets worse after being very good for several months. So those are some of the things I like to cover. Is what are we going to do next if this stops working? If you were just prescribed topical medications, the next step may be an oral antibiotic for a short period of time. If you're already on an oral antibiotic and you've come off of it and your acne flares again, that might be time to have a conversation about Accutane. You can also ask about what other adjunctive treatments or additional treatments can you add into your acne regimen. Maybe the office can offer facials or chemical peels or laser treatments. Those are often going to be out-of-pocket expenses, however, so make sure you know that before you sign up for treatments that wouldn't be covered by your insurance plan. Hopefully these questions have helped you to plan out your next visit to the dermatologist. If the over-the-counter products didn't work for you, you can go on the AAD website to find a dermatologist near you and schedule that visit to get your acne cleared up. Make sure that you're using the best of your time and your money by asking these questions so that you get the results that you're looking for with as few of visits as possible. Thanks again for following along. Let me know if this information helped you today and what you'd like to see next. I can't wait to see you back on the next video. I'll see you soon.